Hello, good evening, everyone. Thank you for joining us for today's Facebook Live Health Talk. My name is Stephanie, currently serving the community of cancer patients as a dietitian in 365 Cancer Prevention Society, and I will be your host for tonight. The main topic of our live health talk today will be focusing on sarcoma. What are the common symptoms associated with sarcoma and the treatment options available when diagnosed with sarcoma? Now, before I walk you through today's talk, please like and share this Facebook video. And also, if you do have any questions, comments, or encouragement, please welcome to do so and comment at the chat box below the video. We will also have a question and answer session towards the end of the talk. Okay, so now allow me to gently walk you through tonight's talk. We are very honored and delighted today to be able to invite two speakers for our event tonight. First of all, we will have a cancer survivor sharing from Madam Kong De Mei. She is a 66-year-old retiree and she has battled against ovarian cancer stage 3 to 4. And next, we will have our main speaker, which we are very honored to have for tonight, Dr. Mark Puhindran. He is the senior consultant from the Department of Hand and Reconstructive Microsurgery from the National University Hospital of Singapore. And after Dr. Mark's talk, we will also have a question and answer session at the end of tonight's program. Okay, before this, allow me to introduce to you 365 Cancer Prevention Society. 365 Cancer Prevention Society is a non-profit social service agency in Singapore, where cancer fighters, caregivers find support in their fight against cancer, where they also learn how to prevent and cope with cancer. The trifold mission of our society are cancer prevention, cancer fighting, and cancer education. And the society achieves its trifold mission through the 7 major services provided to our beneficiaries. Now, first of all, the social service centers, it was created to provide a positive and encouraging environment, caregiving support, and also to serve nutritious meal plans for cancer patients. So SSC promotes holistic care by also organizing and conducting various group and social activities, including physical exercise, like our signature exercise, detox exercise. And it is also a platform in SSC where cancer patients can pick up new skills and hobbies in music, art, and craft, where they have fun while making new friends in the process. Our second major service will be from our counselors. They are professionally trained and they help individuals to better understand their psychological needs and to provide emotional support for cancer fighters throughout this journey. And number 3 will be our dietitian or nutrition support. We provide medical nutrition therapy, nutrition support throughout treatment, individualized dietary consultation, individualized nutritious diet plans. We also conduct nutrition talks and healthy cooking demonstration. The fourth major service will be the care and support team, where they provide care and concern through phone calls and visitations. And they also render number 7, financial support for the needy. So one of the major services that we have is number 6, educational health talks, where we advocate for cancer education. We promote wholeness and wellness through education. So one of the programs that, for example, for tonight's program is also one of our cancer education major services. Okay, next I would like to briefly introduce you to the locations of our 3 social service centers. It's very easy to remember, A, B, C. Now, A is for Ang Mo Kio, B for Bukit Panjang, and C for Clementi. Now, the exact locations and address can also be found in our official website. Okay, right. Before further ado, then I would like to move on to the next segment of tonight's program. The first part will be the cancer survivor sharing by Madam Kong De Mei. And she would share with us her journey and her challenges, her experience throughout this cancer fighting journey. And without wasting any more time, I would like to invite Madam Kong to join us.
各位朋友，晚上好，我是孔德美，今年66岁， 有2个成年的儿女。人生下半场虽然近黄昏，可是却无限美丽。我打算好好享受。2017年10月，计划好跟先生去日本旅游2个星期。刚到日本第一天，我走路的时候，我下腹部有一些刺痛。我回到旅馆冲凉的时候，自己就检查一下，竟然摸到下腹部有一粒相当大的硬块，心里有一些吃惊，但不是很在意。继续完成日本的旅游，回到新加坡才找医生检查，哪里知道检查之下，竟然被告知我得了3到4期的卵巢癌。我身体一向都很健康，连感冒都很少有。平日注重饮食均衡，也喜欢运动。我的父母80、90岁还健在，总以为自己有长寿的基因。而且一直以来我也好吃好睡，没痛没痒。卵巢癌真的是沉默杀手，一点病征都没有感觉到，却已经在我的肚子里长得大过10公分，而且有扩散的迹象。那个时候头脑一片空白，不知道怎么办。一向平静的家也混乱着急起来。我的肿瘤很大，主治医生建议我先接受化疗之后才开刀。治疗方案敲定以后，我心里倒也很平静，找了律师把遗嘱立好，然后去剃个平头，免得我化疗的时候看到头发一把一把的掉。除了化疗除了掉头发，也让我疲倦、呕吐，白血球下降，身体免疫力降低，就容易被感染，所以尽量避免出门。一向活跃的我，就好像被软禁在家里。幸好我的家在麦里兹蓄水池附近，那有那个绿荫遮天的步道，我坚持每一天去走路锻炼体力和放松心情。化疗期间呢，舌头品尝不到食物的美味，对食物失去胃口，但我还是勉强自己少量多餐，保持元气。最重要的是，亲人朋友都很支持关怀我，经常探访鼓励我，从中得到许多安慰和力量。这些爱和温暖让我能够乐观面对生病的痛苦，积极抗癌。在医院化疗期间，我也认识好多位癌友，大家同病相怜，互相鼓励打气。让我感动的是，每一位都是乐观积极，不轻易放弃的勇士。除了治疗之外，我也调整生活的规律，让自己早睡，不要熬夜。人生观也改变许多。我一向急性子，也是完美主义者。如今生活脚步放慢，心情也放松，我也懂得珍惜与身边的人相处的时光，对人多一份包容，及时付出关爱。从生以后，我觉得每一个日子都很宝贵，要活到老学到老，让日子快乐和多彩多姿。从一位朋友那儿得知可以参加365防癌教育协会的课程，出席以后才知道，原来这是个专门帮助癌友的慈善机构。他们为癌友提供许多协助，同时准备各种丰富多元化的节目。在 COVID-19 疫情以前，我曾参加过气球手工课、粉彩画和面包制作等有趣实用的课程，也出席医学讲座等等，在学习当中找到乐趣。365防癌教育协会里有许多善心人士来当义工，在各方面协助癌友，有的辅导关怀，有的上课时来服务辅助等等。感谢这些义工人士的爱心和付出，让癌友得到温暖，也感恩社会上许许多多的善心人士和企业，他们了解抗癌的艰辛，以行动来表达他们的爱心，慷慨解囊支持365防癌教育协会，让癌友得到鼓励和帮助，生命过得更勇敢坚强和有意义。以上是我的分享，谢谢大家。现在我把时间交回给主持人 Stephanie。
Thank you so much, Madam Kong, for your sharing. So because the sharing session was in Mandarin, so I will just briefly recap. So Madam Kong, she was sharing about her experience throughout this cancer fighting journey. So actually, she was traveling to Japan, but there was a sharp pain to her lower abdomen, and to her surprise and her shock, there was actually a lump at her lower abdomen. But nevertheless, she just continued on to finish her holidays. She went back to Singapore, then only to check and find out that she was actually she already had ovarian stage 3 to 4, and this came as a shock for her because she thinks that all this while she has been very healthy. Her family have she thinks that her family has actually lived up to 90 plus years old. They are all so-called, they have a longevity genes, and so actually she was also saying that she's been eating well, sleeping well, so it came as a shock for her. But nevertheless, throughout the challenges, she finds strength that throughout the many blessings and people that she have met, they have been very positive. They have been there to care for her, to love for her, and to motivate her. And throughout the treatment, she also lost her sense of taste. But because with the encouragement that she has, she make it a point that she will have a frequent small feeding in order to ensure that she achieve good nutritional status. And she also come to know 365 Cancer Prevention Society. Before this, she was someone who is very impatient, but now she has learned to slow down and take things one at a step, and she enjoyed the small things in life, making the time more quality. And she also enjoyed being with the friends in 365, and they also attend some of the classes which she enjoyed, like balloon sculpting, baking, and also art classes. So these are some of the tips that she has shared with us, and I believe that what she has shared for us is maybe a lot of our cancer patients, they are going through the same thing, but I think this can be an inspiration to others. Some of the tips, like how we can look at life at a different perspective. Thank you so much, Madam Kong, for your valuable sharing. And with that, we will like to then move on to our main event for tonight. Will be our talk on sarcoma by our main speaker, Dr. Mark Puhindran. He's a senior consultant from the Department of Hand and Reconstructive Microsurgery from the National University of Hospital in Singapore. And without further ado, shall we invite Dr. Mark to join us?
Hi, good evening,
Thank you
ladies.
so much, Dr. Mark.
Thank you. Thanks, Stephanie. Evening, everyone. Thank you for spending your Saturday evening with us. I'm going to speak to you about sarcomas, and hopefully the next few minutes we spend together, it will be of some benefit to you. Now, just give me a second while I get my computer out. Okay. I hope everybody can see what I have. So thanks again for your time this Saturday evening. I'll be speaking about sarcomas, which are actually a very rare form of cancer. They are basically cancers that arise from what we call the connective tissue, medical term mesenchymal tissue. These are tissues that kind of hold the body together. So for example, it'd be things like the bone, fat, cartilage, or the soft bone in our joints, muscle, and things like fibrous tissue, as well as even our blood vessels. So as you can imagine, if they can arise from any of these tissues, they can actually, this kind of cancer can actually occur in any part of the body. Now, how common is it? Thankfully, this cancer is quite rare. It's 1%, about 1% of all cancers. And if we calculate based on what we get from our cancer statistics, it's about 110 cases that we see in Singapore per year. Now, what are the risk factors? What increases your chances of getting sarcoma, this type of cancer? There are genetic causes, but these tend to be actually very, very rare. Things like also previous radiation. For example, patients who've had radiotherapy before, they are at higher risk of developing sarcomas. Lymphedema. Now, lymphedema is actually a very uncommon form of swelling of one leg or one arm, and this often happens after the lymph glands have been destroyed, sometimes after surgery. Then the arm or leg ends up being swollen for a long time, and these patients do have a slightly higher risk of developing sarcomas too. And one last thing is chemicals. The frequently quoted chemical that we hear about is Agent Orange, which was actually used. Unfortunately, we see this in the region a bit because it was actually used during the Vietnam War by the Americans. It's not very common to have chemicals that actually cause sarcomas. So at the end of the day, these are just some of the rare risk factors that we'll see that will cause it. Most of the times, there is no real obvious cause for the sarcomas that we see in our patients. Now, when does it occur? It can occur in any age group, and different forms of sarcoma occur in patients at different ages. For example, there's some like osteosarcoma, which is bone cancer, that actually occurs in children and young adults most commonly. And then there are some other sarcomas that happen as we get older in life. So different sarcomas actually appear at different stages of life. Now, how do I notice it? How do we actually know that this, what you have, may be a sarcoma? And it's actually it starts with a swelling or growth. Now, swelling and growth are very, very common problems that we all have. And thankfully, most of them are benign or non-cancerous. In fact, benign growths are 100 times more common than cancerous growths. For example, this is just a small fat growth called a lipoma. These are all benign. Then, if that's the case, then what are the actual signs of cancer? How do we know that what we have may be a cancer? And these are some of them. Number one, a large size. Frequently we say something that's more than 5 cm in size. Secondly, something that's actually increasing in size, growing over weeks to months. Then there are growths that are very, very firm. When you touch it, it doesn't feel soft. That's also suggestive it may be something more that may be a cancer. And then growths that are also immobile. That means when you try to move them, they're actually stuck to the tissue below. Pain is actually not a very commonly seen thing in the beginning for patients with sarcomas. And that's the problem, because sometimes people always think that cancers have to be painful. In actual fact, sarcomas, when they start out, they are not painful. So it's not a very reliable sign that what this may be a cancerous growth. So I mean, you can see this as an example. It's a very big swelling on the thigh that actually was a sarcoma. Now, when should I see a doctor then if, these swellings may be a sarcoma? I guess it'll be useful to actually, we all see GPs and go to the polyclinics for consultations for other causes. It would be useful to just, if you have a swelling or growth, just go and consult your doctor, ask them, what do you think this is? Can you, do you think it's something that needs to be worked up? Then if the doctor thinks it's not something that's very aggressive, then it can be observed. And of course, over time, if there's changes in it, then you can always go back to see the doctor. So for some evaluation. So when you see the doctor, what can the doctor do? The doctor will take a history, that means ask you about it, whether it's been growing and everything. And then they can do a clinical examination. Now, sometimes just with the history and clinical examination, we actually get enough information to think that this is probably not something bad, and we can advise the patient, maybe we can watch it. But if it's something that we worry about, then we may order some additional tests. This may be in the form of either blood tests or imaging studies like X-rays, ultrasound, even MRIs. And of course, at the final stage, we may actually recommend a surgical biopsy or even removal of the lump. After you've seen the doctor, let's suppose the doctor tells you there's nothing to worry about, but the lump is still there. When do you go back to see the doctor? And we advise is that if you see that the mass is actually, the swelling is actually getting bigger, or there's some change in the mass, let's suppose starting getting harder, or the skin overlying it looks that there's more blood vessels or something. These are some of the signs that it may be good to just go back to the doctor and say, look, I think it's changing. Do you mind having a look at it again? Now, when we do all these tests that I mentioned, the X-rays, the MRIs, how accurate are these tests? Now, unfortunately, none of these tests are 100% accurate. And in fact, each of them tell us different pieces of information. And because of that, we do sometimes order multiple tests because each of them tell us something. And when we try and put everything together, then we have a good idea of what we are dealing with. For example, this is just a simple X-ray. What you can see, this is the bone, the thigh bone or the femur, and there's actually a swelling here. This is actually the mass or the tumor. And then if you do an MRI, it becomes much clearer what's actually happening. So the X-ray is useful because it shows that the bone is actually not involved, but then the MRI shows more, gives us more information and tells us, look, this may be a sarcoma that we're dealing with. Now, even then, with an X-ray, MRI, and blood tests, we still don't have a final diagnosis. In fact, we only get the final diagnosis after the entire mass is removed completely, and then it's actually assessed under microscope by a pathologist. Only then can we get a final answer about what is it that we're dealing with. Now, because of that, does this mean that we have to remove everything just so that we get an answer about what this mass is that we're dealing with? And the answer is no. Because at the end of the day, we have to balance the risk. If not, the doctors will be removing every single one of these lumps and swellings. We don't have to remove all of them. In fact, a lot of them don't need surgery. We can actually observe them, and we need to balance the benefits and the risks, because everybody knows that there's some risk with surgery. There's also some risk in terms of radiation exposure and dye exposure with scans, even like MRIs. So when making a decision, we need to decide what's the relative risk, how sure are we that this is not cancer. We'll never be 100% sure. And then we can either choose to observe or observe this, or maybe do a scan, or maybe even sometimes advise the patient surgical removal. And this is a conversation that we need to have with the patient, because at the end of the day, we can't tell them with 100% certainty that this is not something bad. And it's very important to actually observe and then see the doctor if something has changed. So once we've diagnosed a sarcoma, what treatment is there? The main treatment for sarcomas is actually surgery, where we do surgery to remove the whole cancer. Radiotherapy and chemotherapy, which we know are cancer treatments, we do use them, but they cannot be used alone in the treatment of sarcomas. In fact, the main treatment is surgery. Radiotherapy and chemotherapy can improve the results of treatment, but it cannot be used alone. Now, we know that medical science has improved a lot, and there are a lot of things that we knew that we didn't know about 10 years ago. But I guess we have to be honest and tell you, there are a lot of things that we still don't know. And let me just tell you about them. Now, first of all, we don't understand why sarcomas happen. There are, for example, the risk factors I explained to you. There are most patients with sarcomas don't have these risk factors. And we still can't explain why this happens. Secondly, because we don't know why this happens, it's very hard, to be honest, to give patients advice on how to prevent this reliably. The third thing we still don't know is how can we, when we diagnose a patient sarcoma, how do we know where every cancer cell is? Because we need to know that to see whether the cancer is spread. And while we have been getting more and more accurate scans that help us pick up cancers or signs of spread that are smaller and smaller, we can't pick all of them up. And that's why we still cannot say for sure that we know where every cancer cell is. And the next thing is, will treatment work? For example, will this chemotherapy work for this patient? We know that in general, chemotherapy can work for patients with sarcoma, but will it work for this patient or will it work for that patient? We still don't know for each patient and each cancer whether it will actually work for each patient that we see. Are there genetic causes, and is your family at risk? Like I mentioned, we know that the main genetic causes are very rare, but when the patient asks, are you sure that my family doesn't have an increased risk of developing a cancer? The reality is we don't know, because there may be a slightly increased risk, but probably not a big increase in risk of developing these cancers. Was it something that we ate, something that was in the environment, something that we were exposed to when we were in childhood? Again, as far as we understand, the answer is no. But then we know that our knowledge is evolving. At this point, majority of the times there's no genetic cause, majority of the time there's no environmental or dietary cause for these cancers, these sarcomas. Will it come back? And that's a question that, our patients ask all the time after they've been treated. We ask also, will it come back for this patient? And we don't know that. We know what the risk factors are, but we don't know for sure. And that's why we need to continue seeing our patients over the years to make sure that they are well and to make sure that the cancer hasn't come back. Finally, something as simple as how frequently should I go for scans? What scan should I do? There are guidelines that we follow in terms of what scans that we do. But at the end of the day, these are just guidelines, because should you do a scan weekly, monthly, yearly? And secondly, now we're also beginning to understand that the scans that we do have also got some side effects. For example, there is some radiation exposure from CT scans that we do, and we do have to take that into consideration and balance that with the information that they provide us. So that's why we follow certain guidelines to try and balance this relative risk for the patient. Can this be prevented? As I mentioned earlier, unfortunately, no. As far as you understand, we cannot prevent these cancers. But I think simple things like leading a healthy lifestyle and not delaying medical attention, these are very helpful, and we should not underestimate the benefit that all these factors have and we play when we see patients and we treat them for this condition. What research advances are being made? And that's part of the work that we do in the hospitals, because in addition to treating patients, we do work with scientists to do some research so that we hopefully get better at treating these conditions. One of the things that we're looking at is why this happens, what's wrong in the genes, what's happening in the cells that lead to the formation of cancers like sarcoma. Secondly, we're trying to get better at imaging. For example, we're trying to get our scans more accurate, getting more scans available so that we can see and understand these cancers more. We're trying to get better for surgery. We're trying to get more accurate with it so that we cause less, basically, morbidity or harm to the patient while removing the cancers. We're trying to get more accurate with our radiotherapy, such that we deliver radiotherapy to the cancer only and not to the normal tissue that's around. And this is just an example of some of the planning that's being done nowadays by my radiation oncology colleagues. And of course, new medical treatment. I'm quite sure you heard of it, things like targeted therapy, immunotherapy. Some targeted therapy is being used in sarcomas. Immunotherapy not really yet, it's not so well established. Is help available? Well, you are at the 365 Cancer Prevention Society talk, and it's thanks to organizations like this that there is a lot of support available. And we also actually have a sarcoma support group in Singapore that was established, and we've got a very amazing group of patients who are running this and leading this. And this is just one of the outings that they had over at the Marina Bay area. So with that, I'd like to thank you very much for your attention. And I'll now hand this back to the host, Stephanie. Thank you very much.
Thank you so much, Dr. Mark, for the very comprehensive and informative sharing. I believe it is time for our question and answer session. Maybe some of our audience have some burning questions in their mind they would like to ask. All right. So actually, we'll start the ball rolling. I think the first question we have here is, how is sarcoma usually found? Is there any screening? I mean, I think they're worried about, like, you don't even know that there are any signs or symptoms, and then suddenly you have a large lump. So is there any way that we can detect it early or to screen for it?
Unfortunately, there is no screening test available for sarcoma, unlike things like colon cancer, breast cancer, cervical cancer, where that simple tests are available. There isn't a simple screening test for sarcomas. Now, quite often, the patients will notice a lump or swelling, and this is the first sign that brings the patient attention to this. And I think when you notice it, then it'll be useful to then maybe see either a GP or polyclinic doctor just to get an initial assessment as to what this may be. And the other thing I would like to emphasize also is the importance of watching for change, because these lumps are very common. Not all of them need to be removed immediately or maybe scanned. But if it changes, that's actually a very important piece of information and something to watch out for. And if it does, go back and see the doctor.
Okay, thank you very much, Dr. Ma. I think it's very well answered. So, basically, there's no screening test, but do detect for lump, and if you do detect a lump, do seek for medical investigation straight away. Okay, thank you. And then I think we have one question from the audience here. Where does sarcoma like to reside, and where does it like to spread to? Is there like a particular body part that the sarcoma would be more high probability to reside and spread to?
Sure. So more of the sarcomas tend to arise in the extremities. That means the limbs, the arms, and the legs. About 60% of them arise there. But then we also have the other 40%, and they may come from areas like inside the abdomen, inside the thoracic cavity, the chest cavity, or even the head and neck. So they can arise in any area, but the more common location will actually be in the limbs. So that will be it. And where does it spread to? That's the challenge we have with sarcomas, because there are actually many different subtypes. The most common location that it spreads to in general is to the lungs, which is why it spreads through the bloodstream and it goes to the lungs. And that's why we would actually, on follow-up for our patients with sarcoma, that's the main place that we look for. We look at the site where the thing came from, the original site, or what we call the primary site. And we also then would evaluate the lungs more closely. There are differences between different sarcomas. Some of them may go to different places, but for sarcomas, it tends to be the lungs.
Okay, thank you, Dr. Mark. Okay, we have another question from the audience here regarding monoclonal antibodies therapy for the treatment of cancer. So yeah, the question is, what about monoclonal antibodies therapy?
Okay, I'm not a medical oncologist, so won't be the best person to answer, but let me give it a shot. Now, monoclonal antibodies tend to be specific created antibodies. Antibodies are basically part of our immune system. So they actually go and attack foreign targets, they bind to it, then the immune cells come in and destroy those foreign targets. In monoclonal antibodies, they're actually synthetic or created antibodies that attach to specific areas on different cells. So for cancer, the hope is that you would find a target on a cancer cell that the monoclonal antibody will attach to, and then the immune system comes to destroy it. So it's actually, you can imagine, it's actually a very specific process. And monoclonal antibodies are not only used to treat cancer, they even used to treat conditions like osteoporosis. So yes, monoclonal antibodies are used to treat cancers. As far as I know, none of them are being used to treat sarcoma specifically, though I think they're being looked at. And there are many different types, and they have been manufactured for different purposes. So different cancers, different monoclonal antibodies.
Okay, thank you very much, Dr. Mark. Okay, I think we have one more question from our audience here. She's asking, does that mean that sarcoma will come back even after surgical removal and radiation treatment?
Well, if sarcomas were definitely going to come back after our treatment, then it'd be very sad for us and the patients. No, we do treat patients successfully with surgery, and then also if we have to, radiation, but it's not 100% where we'll be, it's not a slam dunk where we'll definitely be able to eradicate the disease. And that's why we need to follow the patients up. Now, in terms of what are the things that are associated with success would be basically, hopefully we get to catch the cancer early. That increases the chances of successful treatment. And secondly, also sometimes it's also the location of the cancer. For example, if it's located in very difficult areas like around the spine, or certain areas where we cannot do a very big surgery to remove it, then the risk of it coming back are higher. So at the end of the day, sarcoma can be treated successfully. We have quite a few patients who are doing well without any recurrence of the disease, but there is a risk it will come back, and that's why we will follow our patients up to try and detect this recurrence early if it does happen, and then try to do something about it as fast as we can.
Thank you, Dr. Mark. I think it's good news and reassurance that, actually after surgery and radiation, actually we do have many patients that this is completely resolved, and good to know about that. Yeah. But there's one question here about, let's say we have already completed treatment. How long do we need to monitor for the recurrence of sarcoma?
Difficult question to answer. Let me explain why. Because the risk of recurrence never goes away totally.
Okay.
It kind of comes down, and then the highest risk of recurrence is within the first 2 years. But then it kind of flattens out and plateaus, but doesn't totally disappear. So I tend to want to follow my patients for as long as I can, as long as they don't mind coming back to see me. Maybe after the 5-year mark, maybe I'll see them yearly or every 2 years. But as far as possible, I would want to follow them up to see them for as long as possible. So I don't draw a line. Normally, some people cut it off at the 5-year mark, some people cut it off at the 10-year mark. But sometimes I just push it a little bit further and longer if I can.
Thank you, Dr. Mark. I think we have just one more question from Patrina. She's asking, are there any specific symptoms for sarcoma in the spine?
Very difficult to find them. That's the problem, because sarcoma in the spine is actually very, very rare. So it's one of the problem when we have sarcomas in the spine is they tend to be located. I mean, it's in a deep location. You cannot actually feel it as a swelling. So it is hard to pick up sarcomas in the spine, and there are no specific symptoms for it. So I would say that's one of those areas, and that's part of the challenge we have. How do we pick these up early? And it is very difficult to do so.
Okay. I think thank you so much, Dr. Mark. I think there's one more question here. Can sarcoma be prevented? I'm not sure if you have covered in the talk just now, but probably we can answer it for the benefit of those who have missed it just now.
No problem. Unfortunately, sarcoma cannot be prevented. That's the short answer, which is unfortunately what it is for now. We don't even fully understand what causes it, what starts it. And when you don't know how something starts or why it starts, then it's very difficult to be able to prevent it. I think what's important would be trying to actually pick things up early and going to see the doctor when it's actually small, and going back to see the doctor if that's changing. If there's one thing I would say, these are the things that would give us the best chance of treating this disease condition for now. Hopefully, with research and as we understand this condition better, we will be able to prevent it one day. But for now, that's not something that we can do.
Okay, understand. Dr. Mark, we have one more question here. It says that can you survive sarcoma? Like how fatal it is, and like what are like the survival rates of a sarcoma?
I guess the most important, the two things that I would say determine this is whether there's signs of spread the moment the patient comes to see us. Because if there's already a sign of spread, and there are patients who see us when it's stage 4 disease, it'll be very hard for us to cure the patient. In fact, to be honest, we will tell the patient, I don't think I can cure you. The objective of treatment for patients with stage 4 is to keep them as comfortable as possible for as long as possible. So, however, for patients with early stage disease, then there will be or sarcoma that hasn't spread. Then a few other things would determine the risk of this. For example, the size of the cancer, the sarcoma, the grade of it. Now, grade is basically how aggressive the cells look under a microscope when you actually look at them. Because the cells look very aggressive, then we know that okay, this cancer is probably something that's behaving in an aggressive way. the chances of us being able to, the chances of it coming back are not small. And also the location. For example, if you're located in areas where you cannot do a very good clearance of the cancer. So this is different from things like colon cancer, where it's restricted to the colons, or breast cancer, which is restricted to the breast. Sarcomas can actually occur in every location in the body, and in some locations in the body, it's just very difficult to do a complete removal of it, because we end up causing a lot of harm to the patient in the process of doing that. And that's where sometimes we have to back off with our surgery and maybe not remove the cancer with what we call margins. Basically, how far you get from the cancer to away from the cancer within normal tissue, that's the margins. And that actually does influence the risk of it coming back. So these are all the factors that we look at in terms of the risk of sarcoma recurring.
Thank you, Doctor. We have one question from the participant here. She's asking, what is meant by low-grade sarcoma?
Okay.
Low-grade sarcoma.
So grading is basically something that is done after the cells are looked at under a microscope. It can either be done after a biopsy, where we take out a small piece of it and look at it on a microscope, or after we've removed and the entire tumor and analyzed the whole thing. What the pathologist actually looks at when they're looking at the microscope are things like how aggressive the cells look. Do they look like they're dividing very fast? Did they look like they're invading different areas? These are all multiple factors that the pathologist looks at to try to decide on the grading. So low grade means under a microscope, the cells do not look so aggressive. So for low grade sarcomas, we take it to mean that there's actually a lower risk of it breaking away and spreading to other sites like the lung. High grade tumors that look more aggressive under the microscope, these are basically, we interpret this as having a higher risk of breaking away, spreading to different parts of the lung, and basically that's the grading system. So low, some people use an intermediate grade also, they have an intermediate grade, and then there are high grade sarcomas also. So there are 2 or 3, depending on, there are different systems of classification, so it depends on which one is used.
Thank you very much, Dr. Mark, for the detailed explanation. We have a few more questions here. The questions keep coming in. Okay, so there's this question about, do you mind to share your perspective or your comments about TGMO, a phenotypically driven, therapeutically guided multi-drug optimization? So yeah, just wondering, Dr. Mark, do you have any comments on that?
I haven't heard of this before, so I won't be able to comment about this one. Sorry.
All right. Thank you, Dr. Mark. I think we move on to the next question. Our participant is asking, does lower immunity, like if you keep catching illnesses and dengue, does it mean that you have an increased risk of recurrence of sarcoma? Does lower immunity means that you have an increased risk of sarcoma recurrence?
That's a very good question. And I mean, to be honest with you, I don't know what the evidence is. I'll tell you straight off. But then I think all of us in our hearts will believe that if you're not so healthy, if your immune system is weak, then the chances of you either having, something bad happening are higher. Do I actually know the data for this? No. But it's a good question. And I guess that's the whole reason why, even things like diet, exercise, leading a healthy lifestyle, even though there's no direct link, for example, to sarcomas, we actually do strongly encourage our patients to adhere to it, because even if not for cancer recurrence and cancer treatment, it's good for lifestyle, for life. I mean, don't forget, we still need our hearts to be in good working order. We need we need things like, stroke prevention and everything. All these are part of us living as a person. Our life isn't only about cancer. So while we may be able to link with, this question is about immunity, but also things like diet and everything. We all know that it's important, and that's why we should pay attention to it.
So thank you so much, Dr. Mark. So I think that it is evident to all that besides medical, your lifestyle, your diet, your exercise, your immunity, and all that plays a role in maximizing your quality of health as well. Okay, so we have one more question from a participant. She's asking whether is surgery the only option? Is surgery the only option? For treating this?
I think surgery is the main option for successful complete treatment of sarcomas. There are no sarcomas that can be treated successfully without surgery, but we do add in chemotherapy or radiotherapy, or sometimes even both, for specific sarcoma subtypes, not for all of them. In fact, I would say that for most sarcomas, we do not use chemotherapy. We may use radiotherapy more often.
Okay. I think that's a very straightforward answered already. So one more question from participant. They are wondering whether can biopsy cause sarcoma to spread? Right.
Difficult question for us, because theoretically the answer is yes. At the end of the day, when we do a biopsy, then we are actually introducing either a surgical cut or a needle through normal tissue in order to get to the sarcoma, and then removing it, and then the cells can easily spread along the track that we have created. So theoretically, a biopsy can cause what we call local spread of the sarcoma, and that's why we are very careful when we are planning our biopsy incisions, because when we are trying to remove, when that's supposed to be done a biopsy, and we are trying to remove the sarcoma, we have to try to figure out, okay, which path was taken during the biopsy procedure so that we can remove the whole tract. Now, because of that, I mean, biopsies, there are risks to a biopsy, there's a risk of local spread, but on the other hand, there is also the need to know what we're dealing with. Because the surgery that I do for sarcoma and cancer is very different from the surgery that I will do for a non-cancerous condition. So I do need to know, and that requires a biopsy very often, I do need to know whether I'm dealing with a benign tumor, a non-cancerous growth, or am I dealing with cancer? It makes a difference to the treatment. So we do explain that to the patients when we are going to do a biopsy, because we do take that risk, and we sometimes have to take that risk.
Okay, understand, Dr. Mark. So another question that we have from our participants is that they're wondering, is it true that cancer cells are continually neutralized by our immune system?
Great question. The answer is yes. Actually, they are actually being, our immune system actually does a tremendous job of getting rid of cells that have gone, that are dividing uncontrollably, and this basically are what cancer cells are. So our immune system actually does a fantastic job, and it's just that the cancers are actually the ones that learn how to hide away from it. So they try, somehow they manage to find some way of hiding from the immune system so that they can grow without being attacked by the immune system. And then, and that's the basis actually for immunotherapy, which is, I mean, it's been emerging for some of the other cancers especially, where you try to basically stimulate the immune system to try and pick up the cancers to eliminate them. So yes, our immune system does continue to get rid of cancer cells. The cancers that grow and affect patients are actually the ones that learn how to avoid it, and then cause the damage to the patients and to us, basically.
Thank you. Thank you, Dr. Mark. So the next question from our audience is, does sarcoma surgery means amputation?
No. Okay. There are times, the answer is no, because it used to mean, especially if you have sarcoma growing in the extremities or the limbs, it used to mean amputation in the past. And when I say the past, I would say maybe 50 years ago. Nowadays, I would say that a majority of our patients we can treat without amputation. But that really depends on the patient coming to see us early, because if the patient comes in with a very advanced stage of sarcoma, then it will be difficult to save the limb, and amputation may actually give the patient a better outcome. Now, when we talk about amputation, I would say that amputation isn't like an end, because we do have, I mean, everybody's seen, I mean, a lot of athletes, the Paralympics and everything, a lot of athletes who may have undergone amputation, maybe from injuries or whatever, and they're doing remarkably well in their lives and as athletes. So amputation isn't an end. Now, just bringing it across to cancer treatment, we do offer amputation under two circumstances. Number one, if we really need it for cancer control, because life will take precedence and it's more important than preservation of the limb. Though we do try our best to preserve the limb, because nobody likes the idea of an amputation. The second instance is when we feel that even if we do limb preservation surgery, and we can do many ways, or we can reconstruct the limbs in many ways, but at the end of the day, if the reconstructed limb ends up functioning worse than if we actually did an amputation and then put a prosthesis for the patient, then we should offer the patient an amputation too. So I would say that we still do it. We do it rarely, do amputations rarely, but we still do amputation for some of our patients.
Thank you, Dr. Mark. I think it's good to know. I think the very consistent messaging that I've listened throughout this talk is that early detection, early intervention is very important, right? And then I think one more question from the audience here is that how can we balance the frequency of CT scans to monitor as it kills good cells, right? Yeah.
So that's about the staging system. And I mean, it's not only the CT scans, because the other things that we have to consider are how old is the patient, because we know that radiation exposure in a young child is actually more harmful than radiation exposure in an adult. So in addition to the cumulative numbers of scans, there's also the age of the patient to consider when we're actually doing our scan. So there are guidelines, and I'm not going to go into details about them, because there are different ways of approaching the surveillance issue in terms of doing CT scans for patients, but there's no absolute number. There are many relative things, and it's very hard also to get good information about how much is too much, because the only way you can actually tell how much radiation is too much for a patient is actually to expose a patient to radiation, and that's crazy. We'll never ever do that. So I think we have to kind of, in a way, have to discuss this with the patients and then explain to them what we can and cannot see, what's the risk, why we're doing these scans in the first place, and what it can tell us before we then make a decision about how often we scan and what scans we actually do.
Thank you, Dr. Mark. Due to the benefit of time, we will just take in one last question. And this audience, he or she is asking, how do you know when sarcoma has invaded the lungs? So will there be any signs or symptoms that sarcoma has invaded the lungs?
In an early stage, we do not know. And that's why for patients with sarcomas, we do bring them back, and we do imaging of the lungs, either in the form of a chest X-ray or a CT scan of the lung, because quite often when it first spreads to the lungs, it's actually silent, because the lung has a lot, even though basically think of it like the sarcomas destroying the lung tissue, but because there's a lot of reserve in the lung, we don't actually pick it up if we didn't do things like the X-rays and everything. Only at a later stage, then patients may have problems like either coughing out blood or shortness of breath, but that's in the late stage. We try to pick it up early, and that's why part of the reason why we bring our patients back and we do get tests for them, it will be in the form of an X-ray. It will be in the hope that if there's something in the lung, we'll see it earlier before it starts causing the patient's symptoms.
Okay. Thank you so much, Dr. Mark. I believe due to time constraint, we have come to the end of our question and answer session. And thank you so much, Dr. Mark, for being with here tonight. And I think the talk is very professional and very informative. And thank you so much for your patience in answering all the questions as well. I think that many of us find that it's enlightening It's not every day that we can just Google and there may be a lot of false information out there. And thank you for having a professional and specialist like Dr. Mark to be with here tonight to answer some of the burning questions on our audience minds. So with that, I would like to thank Dr. Mark once again for being with us on here tonight. And probably we'll just go on to share our subsequent. We've come to the end of the program, but don't forget to like and share our video. And then I would just like to gently introduce you to some of our upcoming events, because every month there will actually be two live events that we have here on Facebook Live. The next one will be on the 5th of December. Okay, this recipe demo will be conducted in Mandarin, entitled 缤纷色彩水果冰沙. So I believe this is a recipe demo on a colorful fruit smoothie. So this will be conducted by Miss Anna. She's a very famous food and wellness consultant. So do join us on the 5th of December as you discover some of the interesting recipes that you can try out at your home. So besides the event on 5th of December, we also have another recipe demo on the 12th of December. This will be conducted in English, healthy Christmas desserts. This recipe demo, we will demonstrate two very easy and very healthy recipes which you can try out at home and share with your loved ones for this festive Christmas season. Okay, so thank you very much, ladies and gentlemen, once and for all. Thank you for joining us tonight. And do remember to like and share our Facebook and Instagram page, where you can also tune in to the updates of our upcoming events. And we've come to the end of our program. Thank you so much for staying with us, and see you in December.